Welcome back, beautiful tri-state area. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. I'm your host, Zen Sams. Welcome back to the Better, Brighter You segment brought to you by Cyspera. Today, we're featuring the incredible board-certified dermatologist, Dr. David Goldberg. In 2020, Dr. Goldberg merged his three-office practice with the Schweiger Dermatology Group, the largest dermatology group in the New York, New Jersey, Pennsylvania region, and the fourth largest dermatology group in the U.S. Dr. Goldberg currently serves as the director of cosmetic dermatology and clinical research for their over 75 offices. He has an impressive list of accolades, including being the first ever recipient of the ASLMS Leon Goldman Award, named after the founder of laser medicine, and is also an educator, an innovator, and an author of over 170 peer-reviewed manuscripts and 15 books. Wow. He's going to join me right now to chat all about the importance of safe and effective treatment plans from pre to post procedure, as well as the key legal considerations doctors need to be aware of in their practice. Welcome to the show, superstar.
It's great to be here.
Excited to have you back on. We love our experts on the microphone, and you are one of our most popular ones.
Let's start.
Let's dive right in. So, something people may not know about you is that you are also an attorney, right? Having graduated from Fordham University School of Law right here, where you currently serve as an adjunct professor of law and taught a course called Advances in Healthcare Law. This is so interesting to me. And you even still write a monthly column called Legal Eagle for Dermatology Times. So you stand at a very unique intersection of both medical innovation and the law. So for all our doctors listening right now, aspiring or practicing, what important things do doctors need to understand from a legal perspective when treating patients?
And you're correct, Sam. I mean, I have two perspectives. I wear two hats, both as a practicing physician who does cosmetic dermatology and as an attorney who has taught healthcare law for over 20 years. I think the first thing to think about is the end. And that is physicians are emotionally very vested in their patients. And most of them are really good quality docs. And then they get sued and they go, how can I be sued? I mean, I've done everything I know that I can do. I'm trying to do the right thing. And the end result is, with the American system we have, it's not hard for plaintiffs or disgruntled patients to file a lawsuit. In the end, you have to recognize that you can't get emotional about this. There is a reason that we have life insurance, health insurance, and medical malpractice insurance, and that is to protect us. And in the end, if you practice quality medicine, you may get sued. You likely will get sued, but you also likely will not lose the lawsuit.
That's a great perspective. I like how you framed it, because you're not saying it's never going to happen. You're just taking the fear out of it when it does happen. So it's a great mind shift. Now let's change gears and talk about a specific innovation you are an expert in: lasers. Now, laser technology has revolutionized the field of dermatology and offers really effective solutions for everything from pigmentation to skin rejuvenation. However, as with any powerful tool, it's important to tailor treatment plans for each individual patient to optimize both safety and outcome. So what precautions do you take when treating patients with lasers? And do you pre-treat darker skin patients with topicals before their lasers?
And so, as you alluded to, this field has exploded. I mean, I'm doing this now almost 4 decades, and we call them lasers, but it's not just lasers. There are light sources, there are electrical radio frequency devices, microwave devices, ultrasound devices. We can treat virtually every area of the body. And as you point out, half of our population is darker skin. Darker skin is much more sensitive to the colored light of some lasers, and certainly very sensitive to the heat induced by lasers, whether it is for pigmentation problems, whether it is for facial resurfacing of wrinkles, whether it is for cellulite. You can go on and on and on. And so when you treat darker skin, you have to really be conscious of the fact that you need to use the appropriate devices. And some devices are not necessarily ideal for darker skin. For example, many spas have only intense pulse light sources. They are great for treating red, but they are not good for pigment, ideally. And so when we start treating these darker skins, we have to be wary about what may happen if they're overheated or if the wavelengths, the colors of light, are not appropriate. And we often pre-treat to try to lessen problems with pigment, and we certainly post-treat to lessen problems with pigment.
So how would you handle a darker skinned patient getting post-inflammatory hyperpigmentation or any other complication after treatment?
Well, and that is the most common complication is post-inflammatory hyperpigmentation, or alternatively, some darker skinned people, particularly women, have a condition known as melasma, which puts pigment on their skin. And if you start lasering them and you don't think about the issues I just discussed, you're going to make melasma worse. So there've been a whole variety of lightening agents on the market for over 20 years already. The problem with many of them is they either involve the use of a retinol, which we like to use often for wrinkles, but can create some irritation and can therefore create more hyperpigmentation. And some of the more popular topical agents used to treat excess pigment contain cortisone or steroids in them. And that's okay for a week or two, but it's not okay for long term use. Over the last couple of years, there have been newer products that contain cysteamine in them. Cysteamine is a potent lightener that really helps us to treat some of these darker skinned individuals. And then over the last year and a half, this cysteamine has been combined with a substance known as isopionic amide, which also is lightening agent. So the two of them are put together. It's an ideal marriage, and it really helps us pre-treatment and it helps us post-treatment to lessen or treat the problems of hyperpigmentation.
And this leads perfectly into my next question. So let's chat about both pre and post procedure care because this can really optimize treatment outcomes and decrease downtime and even reduce the risk of these complications we've been talking about. Now, in your expert opinion, how important are pre and post treatment as a part of the entire treatment plan for a patient? And more importantly, what types of technologies or treatments do you recommend?
So the notion of pre-treatment is a little controversial. Some people say it doesn't help. I do believe it does. So to pre-treat these people with something like this product, which is known as Cyspera. Post-treatment, this is now the standard of care. That is, if you treat darker skinned individuals and you're going to create either heat in their skin or excessive light, or you're concerned about pigment, if you don't treat them with a product like Cyspera, with that cysteamine and isopionic amide, that is, in the legal terms, a breach in the standard of care. If they end up with excess pigmentation because you did not do that, you're going to get sued.
Wow, that's one way to
Pretty
put it, right?
simple,
So that's
right? It's not complicated. Yeah.
not complicated. Okay. And to go one step further beyond physical benefits, there's also the emotional and psychological aspect of patient care. So, in your experience, does having a clear post treatment plan help put patients' minds at ease and put things into perspective, giving them like a sense of support and reassurance that ultimately contributes to a smoother recovery?
The part of what we do obviously is using devices to make people look better, but there is often a psychosocial part of this also. I mean, the people are coming in because they want to look better. This is not something they have to do. And if they know you're going to be doing things to lessen the chances of complications, besides your own skill level, it makes them feel better. The provider, the physician always feels better because I know they're going to be okay. And you build a much better relationship with that patient. This is what communication is all about. One of the causes of lawsuits in our practices is physician inability to communicate well with patients. This kind of, use this product before treatment, use this to spare after treatment. Therefore, you're not likely to have a problem. That just builds a better communication.
I like that. I like that. Now let's shift back to laser tech, but specifically talk about the hands behind the treatments, right? So as this technology becomes more widespread and accessible, it's very important for patients to understand that just because someone has the title doctor or practitioner in front of their name, that doesn't automatically make them an expert in this technology. You have to do your research. You are someone that is highly respected in your field. Both your peers and your patients really have the most utmost respect for you. So I'd love to hear your take on this. Do you think all clinicians are perfectly trained and qualified to be doing laser treatments, or do patients really need to be careful with who they go to and more importantly, how can patients safeguard themselves in these circumstances?
Yeah, so this gets a little complicated because obviously there are physicians treating patients, and they can be anywhere from dermatologists, plastic surgeons, to frankly general practitioners. There are also physician assistants and nurse practitioners who are trained to treat these people. And depending on the state, I mean, there are some states in the United States, I'm in New York, that's not one of them, but there are some states in the United States where estheticians can use all these devices. Obviously, training is the key. There are doctors who are poorly trained, there are physician assistants who are poorly trained. And sometimes it's hard for the patient or the client to figure out, are they well trained or not? But they've got to ask the questions. How many years are you doing this? If I'm coming to your office or your spa, do you have one machine that you use for everything, or do you have multiple machines? And why do you have multiple machines? I co-run and co-own the Aesthetic Extender Symposium. It's in its 19th year in Florida every summer. It trains PAs and nurses to do these procedures. These are really well-trained people. And I would argue some of them, frankly, are better than some doctors doing this. It's all about training and people asking the right questions. Sometimes they don't know the questions to ask, but if you go somewhere and you see the person and they tell you they've been doing this for a year and you ask them what's the name of the machine, they don't even know the name of the machine, I'd walk out.
That's a red flag. Yeah, definitely
it's a pretty
not.
easy one, but you'd be surprised. People do it.
I have witnessed it myself, but yes, you're right. Now, last question before we wrap up here, to touch back on your legal expertise. I love it that you wear these hats. But what important things do doctors need to understand from a legal perspective when working with industry partners?
So the way doctors work with industry partners is sometimes they do research on products, sometimes they speak on behalf of a company. Recognize that when you get in bed, as many of us do with these companies, if they are doing something that's very wrong, you're going to get pulled in as well. And I always describe a case in 2007. I was the primary investigator of an FDA study for a new filler. We're not talking about lasers, but a filler. And it turned out the company knew a lot of things wrong about this filler. They didn't notify us who were the investigators. This was an FDA study. Ultimately, the company got sued, and I got sued as well. I mean, I eventually got out of it, but I got pulled into them because they were doing something wrong. And so, as physicians, if you're going to get involved with industry, it's like anything else. Be careful who you get in bed with.
Yeah, you sleep with dogs, you get fleas.
You certainly do, and bed bugs.
Yeah, for sure. And you definitely don't want the regulatory agencies and all that, the boards coming your way, because that's a whole rabbit hole you don't want to go
They
down.
could be worse than the IRS, then. Yeah.
I'm fully aware. We even have regulatory agencies because of the stock exchange I work at, the SEC and FINRA. I mean, they're just all very, very bad people. So you definitely want to steer clear from them.
They're trying to do their job. Let's leave it at that. Yeah.
Yeah. All right. Well, listen, we could go on talking on and on and on. Definitely love to have you come back. But thank you so much. It was incredible having you on today.
Well, thanks for having me.
All right, guys, listen, that was the incredible Dr. David Goldberg, board-certified dermatologist and director of cosmetic dermatology and clinical research at Schweiger Dermatology Group. You could definitely head to schweigerderm.com and skinandlasers.com to learn more, and check him out on Instagram at Skin and Lasers. You're listening to A Moment of Zen. That was the Better, Brighter You segment brought to you by Cyspera. We'll be right back after this.
A Moment of Zen is brought to you by Cyspera. If skin discoloration is making it hard to find your Zen, Cyspera can help. Stubborn pigmentation, dark spots, and uneven skin tone concerns go beyond the surface, affecting both confidence and self-expression. In a sea of skincare choices, Cyspera stands apart. Backed by science and trusted by dermatologists worldwide, Cyspera is powered by the advanced cysteamine isobonic amide complex, delivering clinically proven results and effectively targeting mild to persistent discoloration while restoring the skin's natural glow. Unlike harsh treatments, Cyspera is formulated for all skin types, including sensitive areas, ensuring visible improvements without irritation. Whether pigmentation is a new concern or a long-standing struggle, Cyspera works in harmony with the skin to bring balance, clarity, and renewed confidence. Cyspera is science-driven skincare for confidence that shines. Find your skin zen and restore your glow with Cyspera today by heading to Cyspera.com.